We had the privilege to sit down with Kate, a youth mental health nurse in the thick of it. The job's non-stop, emotional, and often overlooked. In part 1, we get into the hidden stress, the pressure to keep it all together, and why balance is mostly BS.
Hi, I'm Britt.
And I'm Amy, and welcome to the Every Season podcast.
We're here for a fun time, not a long time.
Hopefully we're here for a bit of a long time. Hey Britt,
Hey Ames.
would you say you need some assistance when it comes to being more aware of your body?
Why, what have you got?
Well, you can download our free 7-step female body awareness kit and see if it helps
Sweet, where?
in the show notes and on our website.
Also, in order for us to be here for a long time,
Please subscribe to our podcast.
So, Kate, can you tell us what season you're currently in?
I think definitely career season. That's something that I'm really focusing on at the moment. But also maybe more so trying to get the career life balance right, I guess.
That is a hard one.
It is a hard one, definitely. I think wanting to succeed at work but also be able to have a bit of balance at home is a challenge for everyone.
Yep. Feel ya.
Believe in balance, Kate? Do you believe that you can never have it perfectly, balanced, so to speak?
I don't think perfectly, no. And I don't think there's ever a 50-50 balance. I think there's always going to be one thing that dominates more than the other. And those things kind of go back and forth as well, where sometimes you have to be able to focus more on what's going on in your life outside of work. And then other times you've got to be able to put more time and effort into career-related things. And I think that that's okay, that it kind of, the balance tips either way, depending on what the need is at the time.
Such a good answer and such a good question, Amy.
Mate, you know what? It's so interesting. It just comes from I actually, years ago, I had a close girlfriend of mine who I met and I did look up to her, and I had so many people in my life being like, you need to balance your work-life balance. And I was like, what?
What
and
is
then
that?
when
What does
I
that
told
look
her
like?
this, she was like, your work-life balance, Ames, looks so different to someone else, you know, and it's about you finding out exactly right, like you said, you know, everyone's balance is different, however that looks, and through seasons you're going to be more steered this way and then others this way, and it's just about forgetting about the noise and the expectations and what all the shit society says, and just ensuring that you know exactly where, I guess, the percentage lies at that time. So thank you, Brittany, I appreciate it. Anyway, Kate, we're super excited to talk to you today.
It's going to be so interesting. I can't wait.
I know. So tell us, how did you get into adolescents' mental health?
Yeah. So I started off doing a nursing degree, so a Bachelor of Nursing. And as part of that, every student does a mental health placement. Usually you get one mental health placement across a 3-year degree. I did one 3-week placement in second year of nursing, and it was actually within an adult mental health setting. And I remember being terrified going into the placement, and within about 3 days, I was like, wow, I actually really love this. Like, I never went into nursing thinking that I would go into mental health. I have a number of family members who have been nurses or worked in kind of the medical field. And I went into nursing thinking that I would probably work in orthopedics, and then did this mental health placement. Yeah, 3 days in. Yeah, I was like, this is so cool. Like, I can spend my days as a nurse talking to people and having these really interesting conversations with people. And I think that's what it felt like initially, was more about, I can have these really cool conversations and get to know people. And that's also a part of nursing that I never really had, I guess, thought about tapping into before. And then as I kind of went through my degree, third year of my degree, I did a placement in youth mental health. And that was when it really clicked into me. And I was like, oh no, this is really what I want to do. I want to work with young people with severe mental illness. I think there's a lot of focus on early intervention with mental illness as well in that younger cohort. And it felt like it was really challenging, but there was a fun element to it as well. And I was still reasonably young myself, but outside of the age range that I was working with. And I guess, I just saw that there was a lot of hope and a lot of positive things that I could do and come into work every day and absolutely love what I do, even though it can be really challenging. And so I went in to mental health nursing, and so I did a graduate year after I'd finished my degree, and then I did a postgrad in mental health nursing, and then I went on after that to do a postgrad in forensic behavioural science as well, because I very quickly worked out that I really liked also working with that cohort of young people, that there's a lot of it within mental health as well, people that are also having contact with the justice system, and I wanted to learn a little bit more about that.
This might be a little bit naive, but like, what is forensic mental health? Because I actually don't know.
Yes. So it's more focusing on, I guess you're looking at the overlap between mental health and young people that end up within custody or in contact with police and those sorts of things. And a lot of the young people that I was working with were going to court and having lots of contact with police. And I was just really interested to learn more about how that kind of interplays with mental health a little bit more. And so that's what prompted me to go on and do the postgrad in forensic behavioural science. I haven't probably used that as much as I would have anticipated. I have stayed very much within the youth mental health setting in a variety of different areas. And so I've worked within youth mental health for the last 13 and a half years, and in a variety of settings. So I've worked with young people with eating disorders, I've worked with young people with personality disorders, I've worked with young people with psychosis, schizophrenia, a whole range of different things. I've worked in inpatient settings, so that's young people who are acutely unwell. A lot of my work over the last probably close to 8 years now has been within the community. So I used to do a lot of intensive outreach work where I would go out to young people's homes and see them in their houses and try and keep them in the community rather than bouncing in and out of hospital. Where I am now, I've moved up into a leadership position. So I now support staff who are going out and doing that work predominantly. I don't have as much patient contact anymore, but it's obviously something that I've kind of developed skills in over the years, and now can support other more junior staff to build those skills as well.
That's awesome.
So amazing. Sorry, go.
Yeah, no, that's right, Britt. Just in regards to like, what's the age group that you specifically like working when you say young people and adolescents?
So youth focuses on the age group of 12 to 25. So there's a huge difference, obviously, between a 12-year-old and a 25-year-old with...
I didn't think it would go up to 25.
No, not did I.
Yeah.
Wow.
What's the reasoning behind that, like from 12 to 25?
I mean, it previously was 15 to 25. It's only been in recent years since the Royal Commission into mental health that the age range dropped to 12. And I think that that age range is kind of, that's our early intervention age range. So that's when we see mental illness typically emerge within that age range, and that's when we want to be able to get in and to support people as early as possible to have then, I guess, as little impact as possible on their life.
So if we go back to like your role, I'm sure people can maybe assume what it looks like in a mental health facility.
Yeah.
But could you take us on a little bit of like what you do on a day-to-day basis?
Yeah. So, so I guess now is more, as I said, I'm in a leadership role now. It looks very different and probably not very exciting to a lot of people. But I guess if I think back to more so when I was working in the community and going out and seeing young people. So my day would generally look like I'd have a range of appointments booked. So say I would have, I might have 15 young people on a caseload that I'm holding for a period of time. And so across the course of the week, each day I would either have appointments where they would come in and see me we've got a number of outpatient clinics. So they'd either come in or I'd have to go out to their homes and see them. And so what that might look like is say 4 or 5 appointments across the course of the day. And that might be first 2 might come in and see me. They'd come in, they might have a review with the psychiatrist and myself, and we'd talk about medication and things like that. But also in a lot of ways, it's also about therapy and working with people on goals that they've got. It's not, I think a lot of people think that mental health, and particularly the level of mental health that I work at. So I work within the tertiary mental health system. So that's kind of the really pointy end of the triangle. It's people who are really, really unwell. They've usually tried all the other things. They might have tried seeing a psychologist privately. They might have tried going to, say, a headspace centre. But they've continued to get more unwell, and so they've ended up within the public mental health system. And so, there is, I think, a bit of a misconception that at that level it's all about medication, and it's not. Like, we're focusing a lot on the psychosocial recovery of a young person. We want to focus on what are their goals and being able to help them to see what are their, reasons to get better. What do they want to move towards? Do they want to go on and study? Do they want to get a job? Is it as simple as they want to be able to be more independent and learn how to wash their clothes and things like that? The spectrum of things that I would do in the course of a day were massive. I could go from having a medical review with a psychiatrist and a young person to going out and picking someone up from their house and taking them to a Centrelink appointment because otherwise they wouldn't get there and then they don't have any money. And in the course of driving them to that appointment, you're talking the whole way along and doing a mental health intervention that whole period of time. It's not just about sitting in a room, face to face with someone and talking about what their issues are. There's so many different ways in which you're working with someone's mental health other than just sitting in a room. And sometimes it is just sitting in a room and talking about what's going on for them. But, I've done things like I've gone around and helped people clean their houses. I've taught them how to turn on a washing machine. I had one client I remember years ago who wanted to learn how to wash a car. So I bought out one of our fleet cars and we went and washed the car together. There's a huge variety. I've sat in court with someone for a day because I had court cases and they wouldn't go if someone didn't support them to go. And so the variety of work is huge, and that's what I've always loved, is that every single day is completely so different. And that's really exciting. So it's really hard to sort of talk about what a day-to-day looks like because every day is different.
So I have 2 questions before we go on, Ames, because otherwise I'm going to forget them. But to get into the mental health system, do you have to do a review first? Like, do they come into a clinic, do a review, and then you go out to the public? Because I didn't know you go out to the public and to the homes and stuff like that. I was not aware. So, from there, do you go out to the public from there?
So it depends. There's a number of different pathways. And so so for some young people, their first point of contact would be like triage. So they might be in crisis and they ring a triage line, and that's how they come into contact with the mental health system first. And so then they might have an assessment, again, it might be their first assessment might be in a clinic or it might be at home, depending on their situation. And then a decision is made at that point as to what kind of level of care they need. And so there is, a large volume of referrals that we get each year. I guess the percentage of people that we end up working with is much smaller than the volume that we get referrals for, and a lot of that is referring people out to systems like Headspace or private psychologists or a GP, those sorts of things. But once they've come through, like once there's a decision made that they need case management, then they will be assigned what's called a case manager, and that can be a mental health nurse, an occupational therapist, a social worker, or a psychologist. We all do the same job. And then they'll also have a psychiatrist that works with them as well. And usually then dependent on where things are at for them. So for some young people, they'll only ever come into appointments in the clinic because they have a way to get there. They prefer to come in. They don't want us to go out to their house. For other young people, the only way that we can get to see them is to see them at their house, or, to see them at the park down the street, or whatever it might be.
In regards to like your, I guess the time that you spend with them, is that like is that based like, obviously I'm imagining, Kate, that, some individuals would need more time. So is that just tailored to the individual? Like, your one specific individual, you might have 2 months with them. The other, you might have someone who you're with them for 3 years. Is that how it kind of works?
Yeah. So we try from kind of the point of entry as much as possible to be starting to talk about what discharge is going to look like as well.
Right.
Because we want to keep them linked in with supports that they already have in the community throughout the time that they're with us, because we're only with them for a very small part of their life, I guess. But yeah, it looks different for everyone. So some young people, it might be 3 to 6 months. Other young people we'll see for 2 years or more. It just depends on what's going on for them and what we're working towards.
Do you guys, for the staff, do you guys get like any support, like mentally? Because I would say that would actually like play a massive role on even your own mental health.
Yeah, we do, definitely. And I think because we're all doing it together, and it's very much team-based, so you don't ever want any staff member to feel like they're doing it on their own. You're not having to make decisions on your own. It's done as part of a team. But we have a lot of professional supervision and talking about, what's going on with the clients that we're seeing and those sorts of things. And I think just the peer-to-peer things that happen, throughout the course of the day and the week, a huge benefit. Just being able to talk to other clinicians who understand, that tough phone call you've just had, when you've gotten off the phone and someone's been really upset, and those sorts of things. Being able to just talk to your colleagues is really helpful in itself. But I think that over the time that I've worked in mental health, I've done a number of trainings and those sorts of things. And I think those things and just the work itself have really taught me a lot about myself. And I think I realized very early on that I had to be able to work on how I finish my day at work and be able to go home and not take all of that with me, which, as a very junior clinician, that's not an easy thing to do. I definitely remember going home some days and just laying in bed thinking about a patient that I'd had that day and thinking like, oh God, I hope they're okay when I get to work tomorrow. But yeah, I think over time you develop more confidence in your own skills and your assessment of things. And also, I think I've really strengthened my own internal kind of thinking about how I look after myself, and if I've had a really rough day, what things do I do to help myself wind down as well.
It is.
Great answer.
I mean, it's a whole nother conversation, isn't it? Because I think it's so important. Like, I've got a lot of mates, and I've seen it through my own sister. She's a a nurse in the emergency department, and she was phenomenal in the way that she dealt with and communicated how she would go home and deal with it, because like you said, I think it's something that is so important that they don't, you're not taught that at uni or even at work. It's
not
not
at
something
all.
that is being taught.
Yeah. Definitely.
Yeah, because it's a rewarding job, but it's also intense, emotional.
Absolutely. Absolutely.
You know,
I love my job, and I'm so passionate about it. Like, I could talk about working in mental health forever. Like, I never see myself working in a different industry at this point. But it is really challenging. And I think also I love the challenge. I've always loved a challenge, but it is taxing as well. Like, you do have to really be able to look after yourself and check in with yourself and be able to give yourself, I think, permission to take a day off if you need a day off, or, remember to book in breaks and stop and have lunch and those sorts of things. Otherwise, it can very easily, you could go from 9 a.m. till 5 p.m. and still have work to do. You've got to be able to build in those breaks in order to sustain it. And I think that goes for a lot of occupations. But I think mental health in particular, it's one of those things that you can't give from an empty cup.
No, I think it definitely takes, certain individuals like yourself to do, it's crazy.
Howdy, it's us again. Hope you enjoyed the episode.
Don't forget to download the awareness kit and subscribe to the podcast. Have a fabulous day.